Imagine this. You're having a perfectly fine day until you get a call from your doctor about your latest blood test. Your PSA levels are high. Instantly, panic sets in and your mind races to the absolute worst-case scenario. But before we hit the panic button, let's talk about what PSA actually is. Meet your prostate gland. It's a tiny, walnut-sized gland tucked right below your bladder, doing its daily behind-the-scenes work for your reproductive system. And this little guy produces a protein called prostate-specific antigen, or PSA for short. Normally, your prostate keeps most of this PSA inside itself, with just a few tiny molecules floating peacefully around in your bloodstream. But when the prostate is unhappy, irritated, or growing, it leaks out more PSA. Think of it like a biological smoke alarm. So, when the doctor says it's high, you do what anyone would do. You jump online and ask Dr. Google. Within 5 seconds, your brain is literally smoking, and you're utterly convinced your days are numbered. The internet immediately screams the dreaded C word at you, causing severe anxiety and a spiral of dark thoughts. Enter your doctor to bring you back to reality.
Everything is going
Take
to
a
be
deep
fine.
breath, and
Just
let's look at the
breathe.
science.
You are doing great.
Here
As
is
you
the
can
most
see,
crucial
the
medical
test is
fact you
highly
need to remember.
prostate-specific,
PSA is
but
prostate-specific,
unfortunately
not
not
cancer-specific. There are many harmless reasons this alarm bell rings. For example, BPH, which is just your prostate getting older and physically larger. Or prostatitis, which is an uncomfortable inflammation making your poor prostate swollen, sick, and cranky. Heck, even riding a bicycle or having intimate moments the day before a blood test can temporarily spike those PSA levels. Because of this, doctors often say a high PSA is just like a loud smoke alarm in your house. You hear the alarm ringing, but you don't know if someone just burned their morning toast or if the kitchen is actually on fire. In the old days, the only way to find out what triggered the alarm was to jump straight into a prostate biopsy. And nobody, literally nobody, wants needles anywhere near that particular area if they can avoid it. But luckily, modern medicine gave us a much better, completely painless stepping stone, the multi-parametric MRI. Instead of guessing, we now send you into a giant, high-tech magnetic donut. You just lie there while the machine takes incredibly detailed 3D pictures of your pelvic area. It's loud, but painless. The MRI is specifically looking for dense, suspicious areas where water molecules can't move freely, a classic sign of tumors. If it's just inflammation or a naturally enlarged prostate, the MRI usually sees normal, spongy tissue. But if there's a significant, aggressive cancer hiding in there, it usually shows up as a dark, angry focal spot. A few days later, you're back in the office. The doctor pulls up your MRI results and smiles.
That's wonderful news.
Good news, they say. Your MRI is completely clean. No suspicious lesions. It looks totally normal. You exhale a breath you feel like you've been holding for a week. A literal weight lifts off your shoulder. You're ready to celebrate and go home. But then, you realize the giant elephant in the room. If the MRI is totally completely normal, then why the heck is my PSA still so high? Do I still need a biopsy? To answer that, we have to understand the limits of technology. This is what urologists call the MRI Paradox. An MRI is an incredibly powerful tool, but it is not a perfect, microscopic magnifying glass. Think of the MRI like a high-tech satellite orbiting the Earth, looking down at a dense forest, which is your prostate. If there is a massive, angry boulder sitting in the middle of those trees, the satellite will easily spot it. But what if there are just a few tiny, malicious pebbles hiding deep in the thick grass? The satellite misses them entirely. Back in the human body, those pebbles are microtumors. Clusters of cancer cells so incredibly small that the MRI resolution can't pick them up. These sneaky little rogue cells haven't clumped together into a solid, visible mass yet. But even though they are tiny, they are highly irritating to your prostate. So, the prostate keeps pumping out PSA alarm bells. And that is exactly how you end up with a high PSA blood test, but a completely clean MRI scan. Now, if there is invisible cancer hiding, doctors classify it by how aggressive it is. First, we have the turtles. And on the other end of the spectrum, we have the cheetahs. Fast, aggressive, and dangerous. The good news is that the MRI is incredibly good at catching the dangerous cheetahs. Most turtles are harmless anyway. But here is the million-dollar fear. Studies show that about 10 to 20% of the time, the MRI misses a cheetah. So you're sitting there sweating again, thinking, okay, so the MRI isn't perfect. Does this mean I still have to get the biopsy? Not necessarily. Before anyone gets near you with a needle, doctors have a few more intelligent tricks up their sleeves. The very first trick is actually just simple math. It's a calculation called PSA density. Remember how BPH makes your prostate larger? Well, naturally, a bigger prostate produces more PSA just by existing. Think of it like smoke alarms. Having 10 alarms installed in a massive mansion is completely normal and expected. But having 10 smoke alarms blaring inside a tiny studio apartment? That is highly suspicious. So, doctors take your total PSA score and divide it by the actual physical volume of your prostate measured on the MRI. If the density is very low, your big prostate is just being a big prostate. You can likely avoid the biopsy. Trick number 2 is zooming in on the blood test itself. We look at free PSA versus bound PSA. In your bloodstream, some PSA molecules float around completely freely. They are independent and unattached. Other PSA molecules get attached to larger blood proteins. It's almost like they're wearing tiny handcuffs. Here is the fascinating part. A benign, harmlessly enlarged prostate tends to release mostly free PSA into the blood. But prostate cancer cells? They are sneaky and behave differently. They tend to release mostly bound PSA. Doctors calculate the percentage. If your free PSA percentage is high, usually over 20%, it's great news. No biopsy needed. But wait, what if your density is borderline and your free PSA is right in the middle? Welcome to the gray zone. If you're stuck in the gray zone, we bring out the heavy artillery, advanced genomic biomarker tests. Tests like the Fork score or ExoDx look at your urine or blood for the actual genetic footprints of aggressive cancer. These genetic tests act as the ultimate tiebreaker. They give your doctor a clear probability score, low risk or high risk. If the test says low risk, congratulations. You can safely skip the biopsy and just monitor your PSA every 6 months. Go enjoy life. But what if the test comes back high risk? Your MRI is perfectly normal, but your genetics are screaming that cancer is hiding. This is where we turn to the research. Studies from institutions like the Mayo Clinic and NIH have investigated these exact invisible cases. The data shows that in men with a suspicious PSA but a clean MRI, about 10 to 20% actually do have a dangerous cheetah hiding. How do they hide? Some aggressive cancers grow in a cribriform pattern. Visually, they look just like a sponge or Swiss cheese. Because they are spread out and full of holes, water molecules move freely through them. So, the MRI scans right past them, thinking they're normal tissue. But there's another hidden culprit, asymptomatic prostatitis. This is chronic inflammation of the prostate, but without any pain or symptoms. You feel absolutely fine, but your prostate is quietly irritated, constantly throwing those PSA alarm bells into your bloodstream day after day. So, your doctor is weighing two unseen forces, a hidden, dangerous cheetah versus a silent, harmless fire. The only way to know is to look closely. At this point, your brain is spinning. You look at your doctor and say, okay, just tell me what to do. Do we use the needle?
When
Yes.
it comes to your health,
If your risk is high,
choose
we do the
wisely.
biopsy.
Choose
But we
the
don't do it the
smart
old,
biopsy.
scary, blind way. We do a systematic mapping biopsy. The old biopsy was literally like playing pin the tail on the donkey. Doctors poked randomly hoping to hit the tumor, often missing it entirely. A mapping biopsy uses ultrasound to lay a precise 3D grid over your prostate. It systematically samples every single zone, leaving nowhere to hide. It's like playing Battleship. Instead of guessing, we blanket the board. If that invisible cheetah is in there, this smart grid will absolutely find it. Okay, you say, the grid sounds incredibly smart. But I've read horror stories online about horrible infections after a prostate biopsy. That was absolutely a valid fear in the past. The old method was called a transrectal biopsy, meaning the needle went through the bowel. Because the bowel is naturally full of bacteria, there was a real risk of bad bugs hitching a ride on the needle directly into the prostate. But today, we use the transperineal approach. The needle completely bypasses the bowel, avoiding the dirty zones entirely. Instead, it goes through the perineum, the patch of external skin between the legs. This area can be sterilized completely. Because we enter through perfectly clean skin, the risk of a serious infection drops to nearly zero. The bad bugs are locked out. You let out another sigh of relief. Okay, no infection. But what about the pain? A dozen needles sounds agonizing. Not anymore. Depending on your doctor, you'll either get incredibly strong local numbing or twilight sedation. With sedation, you literally take a nice, peaceful 20-minute nap and wake up when the entire thing is already over. Zero pain. So, when you are staring down a high-risk genomic score and a high PSA, you have to weigh the actual realities. On one side, a few days of minor discomfort or blood in your urine. On the other side, letting an invisible cheetah spread beyond the prostate. When you look at it that way, a modern, painless, smart biopsy is a very small price to pay to save your life. You look at your doctor, finally understanding the full picture. You nod confidently. Let's do it. Let's find out for sure. But remember, in medicine, there is one final golden rule. We don't just treat the PSA number, we treat the whole patient. If you are 85 years old with other health issues, we might ignore a slow turtle. But if you are 55, we aggressively hunt down any cheetahs. So, you and your doctor make the call. The biopsy day arrives. You put on the flattering hospital gown and take that nice nap. But then comes the hardest part of the entire journey. The agonizing waiting game for the lab results. Meanwhile, in the lab, a highly trained pathologist is looking at your actual prostate cells under a powerful microscope. This isn't an MRI guess, and it isn't a blood test estimate. The pathology report is the absolute definitive truth. Scenario A, the phone rings. It's benign, just chronic inflammation. You do a happy dance and sleep like a baby tonight. Scenario B, the phone rings. The doctor says the C word. Your stomach completely drops to the floor. But hold on. Stop the panic. While the word cancer is terrifying, prostate cancer is uniquely manageable. If the pathology report shows it's just a low-grade turtle, the treatment might literally be doing nothing. We just watch it closely. And if it turns out to be a fast, aggressive cheetah, we have incredible weapons today, like pinpoint robotic surgery, or highly targeted radiation therapies that precisely zap the rogue cells without harming the surrounding areas. Because of these incredible tools, if we catch prostate cancer while it is localized, the 5-year survival rate is greater than 99%. And suddenly, the entire journey makes sense. You look back at that terrifying original high PSA blood test, and you realize that it wasn't a curse. That annoying, noisy little alarm bell was actually your greatest hero. Because it forced you to look deeper. It caught the invisible cheetah while it was still tiny, treatable, and contained. So, if you are currently sitting in the terrifying gray zone, don't let fear paralyze you. You and your doctor are a team. Make sure you keep getting that annual PSA blood test. Tracking the trend of your numbers over time is incredibly valuable. And in the meantime, focus on what you can control: a healthy diet, regular exercise, and managing your daily stress. A healthy, uninflamed prostate means fewer false alarms, less medical anxiety, and far more peace of mind for you. As always, I am just a friendly doodle doctor on the internet. Every man's body is unique, so please consult your own urologist before making decisions. To recap our journey today, a high PSA is usually just a loud smoke alarm. It absolutely does not automatically mean cancer. An MRI is a fantastic tool, but remember the MRI Paradox. It is like a satellite that can sometimes miss up to 20% of hidden tumors. And if advanced tests show high risk, the modern, painless transperineal mapping biopsy is your safest, most accurate path forward. Because at the end of the day, knowledge is your greatest weapon against medical anxiety. When you understand how it works, the fear shrinks. So take a deep breath. Don't let your mind race to the worst-case scenario. Just take the journey one single step at a time. Thank you so much for joining me on this deep dive into prostate health. I truly hope it brought you some clarity and relief today. If this video helped you or a loved one, please hit that like button. It tells the algorithm to share this crucial info with other men who need it. Got a question or want to share your own biopsy story? Leave a comment down below. Let's support each other in this community. Stay healthy, stay proactive about your numbers, don't let the internet scare you, and I will see you in the next video. Upbeat, cheerful doodle-style outro music plays and gently fades out.